Hi, welcome to 101nursing.com. My name is Priscilla, and today we'll be discussing amniocentesis. Amniocentesis is a procedure done when a woman is pregnant, usually, most likely, um, and it is called the insertion of a needle through the abdominal maternal wall within the amniotic sac. So this needle is puncturing through the walls and withdrawing about 20 milliliters of amniotic fluid for the purposes of testing the fluid and to see what's going on with the fetus. So this is not a procedure that is done standard for every single woman that is pregnant, but it's usually done in high-risk pregnancies and to see what is going on. Why is the child not responding, or why is the child not growing at a regular pace? What's going on? And they usually wait about past 20 to 24 weeks gestation so that they will not deliver a child before the viability. Basically, how um, if if a child is below 20 weeks, 20 to 24 weeks, they have less of a chance to live, or they won't live at all after 20 weeks. 20 weeks, you have about 20% chance of living as a prenatal neonate. So back to amniocentesis. So it tests for a various amount of genetic anomalies and diseases that is found, disorders that causes fetal intellectual impairment and various other levels. So number one, Down syndrome, Tay-Sachs disease. Tay-Sachs is a disorder that, not a disorder, but it's a genetic condition that is passed down from Jewish descendants. So they're most likely, they're probably the only people that have that disorder passed down to their children, and that the fetus, or that when the child is born, it is dead within I believe it's the week or the day. I'm not completely sure about that, but it's an indefinite death sentence for the child. The next disorder is muscular dystrophy, cystic fibrosis, basically the lining of the lungs and um, the mucous membrane, mucus all around not only the lungs but the GI tract as well is filled with mucus, a layer of mucus. Uh, Spinal bifida, the outpouching of the spinal fluid, spinal cord, and also it checks for fetal lung maturation, fetal lung maturity, also called the LS ratio. And this is very important because it shows how developed the lungs are if anything were to happen, or if the child is even starting to develop, because at 20 weeks the lungs are the last thing to develop. So once it is developed, it is if it's not developed, it's hard for it to be viable outside of the womb, the fetus to be viable outside of the womb. Okay, you want to take this test with an empty bladder, but before you take this exam, you have to have an ultrasound. Here, this is what an ultrasound looks like, and you have your ultrasound technician. Sorry about that. Ultrasound technician. And this ultrasound, basically an ultrasound is the high frequency sound waves, visually, the high frequency sound waves that it's so cool. High frequency sound waves that allow visual structures to appear, which can make little graphic dots all over, and then makes that sonogram, that makes a picture which is called a sonogram. So the sound waves coming in there through the inductor, and then into this sonogram, and that's super cool. And with the ultrasound, you can see if your child is a boy or a girl. You can see if you have twins. You can see how big the child is getting. If the child is proportionate for the gestational week, it's very, very, very effective, and that's one of the awesome innovations of modern medicine right there. And with this procedure, you want a full bladder. I mean, I can't imagine having a full bladder through amniocentesis. I probably will pop. However, you need a full bladder for this because you need the pressure and the interactiveness of the ultrasound machine as well. Anyways, closing with amniocentesis, this examination is it can basically make a woman go into labor prenatally, and that's why this procedure needs to have ultrasound done, and you need to have it between 20 to 24 weeks gestational. I believe I said that before, so you need to have that 20 to 24 weeks, and it's very important to wait before having this procedure done, because if the child is born, there's no chance of it being being alive after 20 weeks. So, and the mother or the woman is to wait at least an hour after the amniocentesis. I mean, think about it. A big hole is being punctured into this protective membrane of the placenta, and it's like you're putting a hole. It's like popping a balloon, essentially, if the person goes into labor. And she's also at a higher risk for a leaking amniotic fluid as well. So, but that is amniocentesis for you guys.